Right, okay. My name is Rene. I'm a consultant psychiatrist and professor of psychiatry. I'm editor of Global Psychiatry Archives, and I would like to put your interest into a paper by Lara Schulze and from the working group of Professor Grabe. They work in Greifswald, which is the former eastern part of Germany. That's a very beautiful area. It's on the Baltic Sea. And so it's a new center, and it's quite a very ambitious research area. It's a German Center for Cardiovascular Research over there, and it's also other research institutions over there. Anyway, so this is a very clear, simple study, and what you should learn about that is that childhood trauma is associated with body mass index, and it's partially associated via depressive symptoms on body mass index. Okay, so what have they done? I'll just keep it short. So they looked at different samples. There's a little table on that, the number of on the patients. So they have this 3 studies, which are follow-up studies, and these studies and these samples are investigated over a long time. So the one they call CHIP study, the other one they call CHIP trend, and there's a medical study of people who have been seen in hospital. So, so it altogether quite a large sample of 3,000 people. And what they've seen is trying to associate the body mass index and the BMI on the average is here 28, which is a bit, slightly overweight German population. The age range is 57, 51, 59. So they're not the youngest people, but so Germany is not a very young area. They have the depression score, which is different in the different groups. But anyway, so they have some different types of abuse, and the CTQ score gives some indication of the different types of abuse and gives a sum score. And what you can see, these are non-clinical cohorts, but this is a clinical cohort, the third one. And what they can see, and this happens in all the cohorts, that there is a correlation, so association or correlation between the sum scores with the body mass index. So they all tend to be significant, sometimes 10, sometimes they're significant related. And there's also some mediation through depression scores. So that means more or less, and you can see it here, that the childhood traumatization is not only correlated with the body mass index, but there seems to be some part which is first and foremost related with the current depression. So childhood trauma has an effect on depression, and the current depression is then a mediator to to increase the body mass index later. So childhood trauma leads to increased body mass index, either directly or via a mediator, which is current depression. So these are quite impressive samples. And I think Professor Grabe has also presented some of these data in his previous talk, which was recorded during the second conference of the Global Psychiatric Association. This is also on our website or on the YouTube channel. Our YouTube channel is Global Psychiatry Archives, and if you want to read the details and the contents of this paper for free, then you can find it on www.globalpsychiatry.co.uk. And if you want to submit a paper, you're very welcome. We're usually quite supportive, and we hope that we will stay supportive for all these, for all your interests. Okay, thanks a lot, and thanks for your interest, and have a nice evening.